All right, so the bill I chose to advocate for is the HR 3127 Medicare Home Health Flexibility Act. It is a federal bill that is still in the introductory level. The sponsors include Representative Lloyd Doggett from Texas, District 35. He's the one who introduced the bill. And there are 25 co-sponsors from 18 states that co-sponsor the bill, and they are bipartisan, meaning they are from both parties. The purpose of this bill would enable occupational therapists to conduct initial assessments as well as the comprehensive assessment in a home health setting, as long as they are the most clinically appropriate skilled service provider. Currently, under Medicare regulations, this is not allowed. OTs cannot be the ones to initiate the evaluation. Some other intended outcomes for this bill is to allow for OTs to conduct these initial assessments, and then it helps define the OT scope of practice, and it supports independent living for clients within their homes. So the policy history and development, like I said earlier, under current Medicare regulations, occupational therapists cannot conduct the initial visit under Medicare Part A home health case. So this bill was introduced in 2019 to address that regulation, because OTs are more than capable to administer this initial assessment. And so the AOTA strongly backs this bill because they know that OTs are more than capable and it falls under their scope of practice. So the AOTA meets with the CMS, which is the Center for Medicare and Medicaid Services, and they meet with them annually to push this bill and try to get it up for vote. The latest meeting in July of 2019 ended with no objections to the bill by the CMS, which is a very big first step in getting the bill up for vote. So policy analysis. So the major obstacles is convincing the Center for Medicare and Medicaid Services to change their regulations, and advocating enough to the public and also to the government officials to get this bill up to vote. So strategies to overcome these obstacles: inform the public of this bill and the role that OTs have in home health care, and then also meet with House officials and advocate for OTs and the passing of this bill. So the policy implications to OT. This bill would help define the scope of practice for OTs, which is kind of confusing. A lot of people don't really know exactly what OTs do, and this adds to the confusion, because in some settings they can do initial evaluations, and in a home health setting they can't. So this would help kind of clarify, and so it also will increase the need and demand for OTs in home health. And then it'll also help with scheduling and staffing for the home health agencies, because right now these agencies have to send out a nurse or a PT or someone else to initiate the evaluation, and then an OT can come out, when an OT is capable of doing the initial assessment themselves. So this way they would only have to send one OT out, and they could do everything instead of having to send multiple health professionals out. So I chose this bill because I am interested in working in home health in the future. I really think this bill would help define the scope of practice, or at least, help define. And then this will allow for OTs to be used to their full potential, because they are more than capable of completing the initial evaluations in these home health cases. And references.